So it's my pleasure to have with us this morning in the series I'm calling Reflections from Pharmacy Leaders Advancing the Profession, Dr. Max Ray. Dr. Ray is professor and dean emeritus at Western University, Pomona, California, and he's a past director of accreditation services for residencies at ASHP. He previously also served as chair, Department of Clinical Pharmacy at the Medical University of South Carolina in Charleston. Dr. Ray was extensively involved in planning for the ASHP Hilton Head conferences, and he's recognized by ASHP with the Harvey Whitney Lecture Award and is also a recipient of ACCP's Paul Parker Medal. So I would like to welcome Dr. Ray.
I'm glad to be with you, absolutely.
Thank you very much. So we'll start off with what we would like to learn more about your journey into your career and recognition as a leader. And in reflecting on your journey, you may wish to include key events or people that influence you in that journey.
Sure. Let me say first to your students that interviews of this sort, in my view, are more for the student than for the person being interviewed. You know, I don't hold myself up as anyone's model. I've had a very successful and satisfying career in pharmacy, and I hope that each of you do as well. But to respond to your question, Dr. Poirier, let me first mention two people, and I don't know if these names will be familiar to today's students, but two people who influenced my life along the way. One is Dr. Grover Bowles. Dr. Bowles was treasurer of APHA for a number of years, a past president of that organization, as well as ASHP. He was my preceptor when I was a resident back in the 60s. And I never made any important career decision without discussing it first with Dr. Bowles. Incidentally, he passed away just last year at the age of 99, so we had a long-term relationship with each other. The other person I want to mention is Dr. Paul Parker. Dr. Parker was at the University of Kentucky for a good number of years. I won't go into his background prior to that, but I never studied with Parker, nor did I work for him, but we became close friends along the way. And he was enough my senior that I viewed him as a mentor. And he also was someone that I went to every time I was contemplating a new change in my career path. So Grover Bowles and Paul Parker, two of my preceptors, and I'm glad of an opportunity to call out their names. It's difficult for me to say what might be viewed later on as the sort of trajectory of my career or the threads that went through it all, but I'll mention a couple of things that I was conscious of throughout my career that I hope did provide guidance in what I actually did. Throughout my career, and I think this was drilled into me by both of the individuals whose names I mentioned, was to help pharmacy make its maximum contribution to society. Now, if one thinks about that, that could take you in a variety of directions. What does that even mean? Well, it's not a question that I could answer in a succinct way, but it's worth pondering, I think, for any professional person throughout their career. How can I make this profession that I'm in more beneficial to the people we serve? That's one thread. The other that I hope I've been able to help in some small way to achieve is to base pharmacy practice on real needs. That is, needs that would otherwise go unmet. No one else would be able to do it as well as we, or as effectively, or as cost effectively, or as efficiently as a well-educated, well-trained pharmacist. So if anyone were to ask me for some sort of succinct summary of my career, I would say that I've been dedicated to doing those two things.
Very good. Thank you very much. And sort of this ties into that, but what do you think is your legacy? And legacy in, I'm going to say 20 years.
Sure.
And in answering that, what are you most proud of in terms of your contribution that has helped advance the profession of pharmacy?
Okay. Well, with respect to the first question, we don't get to choose what our legacy is. We live our lives, we build a record, and then we pass off the scene, and then, you know, if that record warrants, then some sort of legacy may follow. We don't get to control that. Now, and I haven't throughout my career spent a lot of time thinking about legacy. But going back to my earlier remarks, the guiding, I'll call them principles, or the guiding mega goals or the overarching goals of my career, if I have in fact contributed anything to those two broad goals, I hope that I might be remembered in some way for that. There is one particular part of the journey that you mentioned, and let me go back to, and that was the what has come to be known by those who've been around long enough to remember it, the Hilton Head Conference, which was an ASHP and ASHP Foundation sponsored event. This was held in the mid 1980s at a time when there was a movement by a lot of younger clinical pharmacists to have clinical pharmacy recognized as a specialty. Well, I was opposed to that on a philosophical level, because the question that it opened was, well, if clinical pharmacy is a specialty, then what do we call the rest of it? Is there such a thing as a non-clinical part of the profession? And that question was on the table, and there was a lot of debate. And I ran into this debate everywhere I went. And at that time, I worked for ASHP and was doing a lot of traveling around the country. So I had a high degree of exposure to the membership. And this was just on the lips of every pharmacist, every health system pharmacist at least, those who were in two camps. I saw an opportunity to convene, and it wasn't that I did it alone. I went to ASHP and got the support of the executive director and the board to conduct a consensus development conference on the question, is pharmacy inherently a clinical profession? And that was basically the question that Hilton had attempted to answer. We brought together about 200 thought leaders from around the country, and we met for 3 days. And the outcome of that was an overwhelming support of this idea that pharmacy is indeed inherently a clinical profession. Let's put that to bed and move on. And let's build the profession going forward on that assumption. That galvanized the profession in a way that I hadn't seen previously. And so if anyone were to ask me to point to one thing that I took a lot of satisfaction in during my career, that would be right near the top of the list, I suppose, was being instrumental in bringing people together to deal with that question. And, you know, the initiative, and I'm not, this isn't an exercise in who won, but the question was turned down then by BPS. Soon thereafter, pharmacotherapy became recognized as a specialty, but the profession, it was assumed, was inherently clinical, so not a specialty.
Very good. Thank you very much. I'm glad you clarified that and went into that, because the students in the history course will be learning about that. Very good. Thank you. So the next question has to do with advice for students in their professional journey as they become leaders to help advance the profession.
Yes, well, let me make a couple of comments, if I may, about the topic of leadership. And I know that your course has that as a major thread, developing leadership ability. what I would say to any student that asked me to talk about it would be, first, that leadership must have a purpose. If I were to say to a student or to a resident, I want you to be a leader, then you might fairly ask me the question, a leader on behalf of what objective or what goal? To say that one is a leader doesn't really tell us much about that individual, except perhaps that that individual has charisma, people respond to her or to him. And history is replete with leaders who are evil. No question about that. So we have to think in terms of leadership having a worthwhile goal or objective. The term servant leadership has come into being over the last, well, I think Robert Greenleaf wrote his book on the topic roughly 40 years ago, maybe a little bit longer now. And I would encourage your students to dig into that topic a little bit and to think carefully about it. What it says to me is that if a goal is worthwhile accomplishing, we'll figure out a way to do it. And in the process of figuring out how to do it, that's called leadership. So I hope that point is clear enough that I can just leave it there. The verb to lead requires a predicate. You have to lead on behalf of something. Let me just add this one other piece. Throughout our lives and throughout our daily activities, it's almost like a toggle switch. We go back and forth between being a leader and a follower. No one is a leader 100% of the time. And there might be a couple of exceptions. A national leader can probably never be off duty. The president is always accessible by the red telephone or that sort of thing. Most of us, though, have moments during the day when we lead or have the opportunity to lead, and other moments during the day when we are following the lead of others. And I can't think of any better example for this than an interprofessional healthcare team. When we're taking care of a patient, every member of that team has his or her moment when she or he is the leader, taking responsibility. And every member of that team knows when it's turn to step up to the plate and lead. But a well organized team comes to work with that level of understanding. Yes, I'm going to be working together with other individuals on behalf of the patients who are entrusted to our care. Trying to bring all this down to a healthcare level. My point in bringing this up is simply to point out that to be a leader is not just something that is a mantle that we put on in the morning and we wear it all day. It's not something, and even if we attempted to do so, it wouldn't work. We are leaders through credibility, and our credibility as pharmacists comes from our education and training and our clinical experience. The same can be said of a nurse, a physician, a social worker, anyone else on that team has her or his moment to lead. Now, you asked me to comment on examples of leadership I might have provided. Well, I think, I like to believe that I have been motivated by the idea of servant leadership. I've never really had in mind being a leader for the sake of being a leader. I've had jobs that have required that I attempt to lead other people, but I have done so realizing full well that they don't just lead me because I say I'm the leader. I have to build credibility. I have to give them a purpose. I have to build consensus around a goal that we're striving for. So your students, as they move into their professional life, they may have actually wind up in jobs that have leader in the job description. And if so, then I hope you'll be able to remember that. Leading comes with a great deal of responsibility, a great deal of self-consciousness, and I would add a great deal of humility.
Excellent. Thank you very much. very much. I appreciate that. And my final question, as this is a history course as well, we're studying the development and evolution of our profession in the last 150 years. As we study the decade of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. As other key events in our history, events that occur outside of our profession, it helps to shape our profession.
Well,
and I believe COVID-19 pandemic will also be an event that will shape our profession. And how do you see that shaping our profession, being an opportunity for our profession?
well, I agree fully with what you just said. Let me suggest that this is an opportunity for those of us in pharmacy to reflect on where pharmacy fits in the broader healthcare landscape. Now, the COVID-19 crisis, I think we can legitimately call it a crisis, is a public health issue. It brings to bear the need for prevention, for immunization, which is, of course, with the goal of prevention, but treating those who have the illness. Typically, we in pharmacy come into the picture only after a prescription medication has been prescribed, or in another case, providing advice to an individual who has chosen to medicate himself or herself. But the point is, we do largely fall, just by the nature of our profession, we do largely fall within the treatment arm of the healthcare system rather than the prevention arm. Although, you know, we do our part. We do participate in immunization programs. We can go to community pharmacies and receive immunizations. But I want to leave your question with this thought, that it's an opportunity for us to reflect on where we fit in the broader healthcare landscape. And that will be a question to continue to think about long beyond the period when we're dealing with this particular pandemic. I would add to that one thing we can do right now is be knowledgeable about the agents that are in clinical trial, including vaccines that are being tested, early stages of testing, but also to follow the clinical literature on some of the antiviral agents that are currently in the works, and be a source of information there, be a reliable source of information. That we all know that there is a preponderance of, well, I'm just going to call it bad information on the net. Our profession, I think, can be a voice of reason, a voice of scientific validity in helping the public understand how to interpret a lot of the information that's out there. I don't know if that adequately answers the question. If you want to recast part of it, I'll try again.
No, that's very good. I appreciate that perspective. Excellent. That's really good. Again, I'm trying to get your perspective on it, so that's wonderful. Thank you very much. I really appreciate your insights, and this will be extremely valuable. Thank you for taking the time here this morning.
Well, it's my pleasure, and I want to just take this as an opportunity to extend my best wishes to all your students, and I hope that they have as satisfying a life in their profession as I've had.
Thank you.